my friend Aaron Foss, who's also on the call. So next slide, please.
All right, we are going to be implementing some case reviews into our didactics and discussions moving forward in ECHO. We used to more heavily utilize that structure, but found that some of our attendees were kind of shy about wanting to present their cases. But man, that's really where everyone learns the most is from each other. So we highly encourage share your cases, challenging patients, interesting scenarios. Everybody gets so much value from that. So if you have a case that you would like to share or present or run by the rest of the group, please reach out to Katie Stangl. Her email address is listed on the slide, and we can get you looped in with how to share those cases.
Yeah, I think especially with a lot of the 7-hydroxymetragenine stuff that's floating around now, you may have some of those that we're happy to do those cases. We've had quite a bit of that at the addiction clinic here at Centricare, so very tough stuff. Next slide. Coming up, remember December 24th. I don't think I'm going to be here, but I'm pretty sure Aaron's not going to be here, so there will not be an echo that day. We'll come back on in January, and we got a couple great talks coming up for that month. So yeah, remember Christmas Eve we're eating rigatoni. Next slide.
I don't know if I'll be eating rigatoni, but eating something, hopefully that's yummy and probably terrible for me. Just a reminder on the previous slide, there's other echoes available. Feel free to check out the iEcho platform if you're needing additional CME, and check those out as well if you're looking for extra knowledge and education. Technical assistance, don't reach out to us with your personal problems because we probably don't have great answers for you, but case related, patient care related, policy protocol, hey, we're here for it. So don't hesitate to reach out if you need something.
Yeah, or cat training.
Yeah, I need
questions.
that technical assistance, that is for sure.
All right, next slide. Remember, there are a lot of resources on the core website. Please feel free to look there if there's things that you're looking for, different handouts or ways to track patients and so on. I don't know that we have the slide anymore about turning on your video, but of course, Kenzie would love if everybody's face was visible. So feel free to throw your mug up on there so she can see you having fun. We don't care if you're eating, although we are often interested in what you're eating. So feel free to flip on that. Next slide. Oh,
And then we have a couple polls before we start.
Katie, are you able to pull up those now, or do you want to wait for later?
Or we can just skip them for today, so that's fine too. Yeah.
Didn't Katie have to leave?
Yep, she's got school Christmas program going on, so she's probably commuting right now. So welcome everybody. Just want to hand it over to Kenzie Wilcox Ingebrand to introduce herself. But we're so excited to have her presenting on some self-care for healthcare. And I saw that Marcy Smeezing was on, and we were just having this conversation yesterday about how caring for some of our patients can get heavy sometimes with their complex problems, and just seeing some of the tragic, traumatizing, terrible things that happen to our patients, and how do we care for ourselves and cope with that as medical people. So super excited for this presentation, and we'll pass it over to you, Ken, and kick it off.
Is she going to share her own, or is this hers?
She's sharing.
Yeah, I can definitely share. Give me one. Oh, send request.
So I can share the slides for you, Kenzie.
Oh, sure.
Yeah.
Yeah, that's great.
Okay.
That's great. Thank you so much for having me, everyone. My name is Kenzie Wilcox Ingebrand. I am a professional credentialed life coach, and then executive director and owner of Wilcox Group Health, LLC. And I've been a part of that organization for about 10 years now. And so I'm so excited to share my light and energy with you guys today. So thank you, thank you, thank you. Next slide. So what we're going to be talking about is obviously self-care for healthcare, and just a little bit more of that framework and what that means. And of course, my why of why I chose this niche and why I chose life coaching to begin with, or rather, it chose me, much like all the rest of you, right? That your profession doesn't necessarily, and your passion chooses you, and you just have to answer the call. We're going to go through kind of a framework on how to get to know your body in the emotional sense, not in the physical sense, since you guys are all experts at that already. And then we're going to go through 2 exercises, the 5 senses and what makes up the whole person, and building boundaries and what that looks like and how that feels. And because these are a little bit, oof to oofties type things, we're going to do a little bit of a gut check and take some deep breaths, and then move forward on, great, now I have all this big, beautiful information. Where do I go from here? Next slide. So this is the framework of what self-care for healthcare is. It is my life coaching framework in a nutshell. And so I created some exercises, guidelines, funny anecdotes. I think I'm funny, so hopefully you guys do too, but that's totally fine. And just some practical strategies for when you are running around with your head cut off. What can you do to take a step back and get grounded and centered back in your body so you can be the best possible provider and healthcare professional that you can be? And also, we're coaching the whole person, right? Not just the profession. And so I feel like that gets lost in translation. And so when I'm speaking to you, it's not just you as a healthcare provider, but you as a whole person. Next slide. So my why, many of you probably recognize some people in this slide, especially the gentleman with the gopher shirt on with his hat backwards. This is my dad. He is obviously, what is he? He's a physician, sorry, an ER doc and family practice doc. And my mother, who's sitting on the couch over there in this picture, is a registered nurse. And so they met at HCMC and adopted 7 children. I'm the youngest of them. And so with that came a lot of healthcare talk, a lot of guts and gore at the dinner table. Let me tell you, not my forte, but it was really interesting. And it just really made me have a lot of empathy and compassion for people who are not like me. And so with that being said, my sister, who is the other East Indian in the picture, followed in their footsteps and became an OBGYN. And so I saw firsthand what, stress and just having all of these big conversations, like what Aaron said in the beginning, really took its toll on the people in my life. And then I started working with Daddy-O here for the past 10 years. And our bread and butter is community paramedicine and paramedics. And so they are running towards the fire. They are running towards the emergency, right? Just like a lot of you do as well. And that, again, emotional toll wreaks a ton of havoc on your body. And so then in 2020, what happened was someone said, you know what, Kenzie, you should become a life coach, because everywhere I went, people would be attracted to my energy. And I would literally sit in an airport and just like sit next to someone and be like, hey, how's it going? And they would spill their life story to me, literally with 1 or 2 questions. We would be talking about their parents and their upbringing and their siblings and everything under the sun. And so in 2020, I followed that calling and Googled how to become a life coach, which led me here today. We worked with CPs in and out of COVID for the past 2.5 years with Scott and Carver County. And with that, people answered the call and came out of retirement and renewed their licenses. But I also saw the stress in their eyes. I also saw the stress in their body and in their language. And so that's how this framework was born, was because of the stress and turmoil of COVID and everyone who came into my clinics, MDs, RNs, CMAs, LPNs, you name it, they answered the call to help. And so I wanted to help them. And so with you guys, again, being in healthcare, It's time that someone took care of you. Thanks, Erin. Your light shines so bright and so bold. And it's time to start shining that light and turning that light inwards. And so someone starts taking care of you. And that's what we're here to learn a little bit more of on how to do today. Next slide. And so with that, the next thing to do is just how do you evoke awareness? How do you identify your emotions? People ask me all the time, well, Kenzie, I just get in, get out. I shut myself down. I don't want to feel. I don't want to do anything. I just, it's mechanic, it's robotic. And so the first thing I say is, okay, let's do a body scan. And so what this is, and I'm sure you guys have heard of it, is you're literally just going through from head to toe upon different parts of your body and figuring out where there's tension. How does my head feel? How do my shoulders feel? How do my arms feel? Heart, lungs, and you guys can probably go a little bit deeper into this of the systems and muscles and everything like that than obviously I can. But just broad perspective, then it's asking you, what is your body telling you? Why do I feel tight in my left shoulder? Right? And it's like, oh, I've been probably scrunched over. I need to stretch. I need to breathe. I need to let in some air versus being, constricted the entire time. Every place in your body is an emotional capture that will tell you what's going on without you knowing it. And so if you can just be a little bit more aware of that, it will open a completely new door for you. The next one is, what stories are we telling ourselves with that emotion? Like, oh my God, I am so angry. It's like, oh, I didn't know I was angry, right? Why am I angry? Is it because everything is compounding and that makes me be short with my family, with my coworkers, with my friends? Where is that anger coming from? The next one is are these boundaries that I created, are they protective? Meaning I don't want to, I'm too overloaded, or are they just showing up in my authentic self? Which, lucky for you, we will go through. The biggest clinker of that is that you always know, whether it be you or the patient as a client, right? You always know. And so what your job is to just evoke that awareness and provide the space to listen and create your own insights with everything that's going on. Does anyone have any questions about what I've been talking about for the past, 10 minutes? Sweet. Take it. Next slide. So I created, like I said, we're going to go through 2 exercises. So if you guys can have like a writing utensil or just use your phone or your computer or whatever, or just, keep it in your mind and heart, that would be awesome. So this framework is a riff off of the 5 senses, right? Funny, And instead of like touch, hear, smell, everything, it's creating and capturing a sense of belonging, a sense of purpose, freedom, meaning, and love. And you don't have to write these questions down. The next few slides will go a little bit deeper into it. But if you want to answer these questions as we go through them, that's totally fine. Because we can't necessarily, it's hard to move forward with your emotions and in life without knowing who you are at your core. And this will start helping to build that sense of awareness again. Next slide. So the first one is a sense of belonging. That means, right, acceptance, inclusion. When we're with our family and friends, do we feel accepted? Do we feel that we can be our most like authentic selves, like crying like a baby or laughing like a hyena and everything like that, right? Think of those people that you can just let your hair down with and be your true self. Do they create that sense of belonging within you? And when you think of them, what does that feel like? Right? And what does that look like? I know when I tap in, or when I think about it, it's a feeling of like warm sensation and tingly and excitement. And I feel that right here in my heart. I also kind of like feel a little buzzing noise in my ears. So it's a lot of fun to start playing with those different sensations and feelings and see where they pop up in your body. You can go to the next slide, Cinca. Thank you. The next is a sense of purpose, you guys. And so I know with you guys being and who you are, or being in healthcare and what you do every single day, this should be a little bit easy peasy for you, but I'm going to ask you to go a little bit deeper. So bear with me. Your sense of purpose, right? It's the intention to achieve that long-term goal. It's to make a positive impact on the world. And so, again, it's all about self-awareness with this. And so if you're asking yourself, like, goodness gracious, why am I doing this? Right? I'm doing this because of my sense of connection. Why do you do what you do every single day? And think of those words, think of those feelings that have the most impact for you. And then, this is my favorite with clients, is asking and going a little bit deeper of the 3 to 5 whys. Why do I like this, sense of connection? Well, I like bringing people together. Okay, why do you? Well, because I love the feeling that it provokes within me and the smile within them. Okay, great. What feeling does it provoke in you and why? Well, I don't want anyone to feel left out. And that's why I cultivate a sense of belonging or a sense of connection. It's that. Do you know what I mean? So you just kind of go 3 to 5 whys, and that will help get to that core root of why you do what you do every day. So when you're feeling that little oofta-oofties coming up again, you can go back to your why. And it will help kind of instill some sense of purpose and power back into your step. And that kind of goes on to our next bullet of, what was shaped by your core values and beliefs? What experiences brought you to this? And we will talk about your core values and beliefs in the next few slides, so don't worry about that. And so, sorry, my dog is over here and he's just having a little field day. So if you hear him in the background, I do apologize. And lastly, what makes you tick? Why do you get up in the morning? Again, it's that sense of purpose. Why do you put on your shoes? Why do you go out the door? What's making you do that and follow that passion? Next slide. Next is the sense of freedom, which means the freedom to be yourself. And so I love this one. This just gets me going. So what gifts are you using for others, right? And what gifts are you using for yourself? And so it can be gifts of I love writing and painting. And so I do that for me. Sometimes I post it. But I do that for me because it brings me joy into my life. So what gifts, and it's not just your profession, right? What gifts are you utilizing for yourself and for others? And this is kind of a hard one. So practice saying no. Meaning if you're just giving and giving and giving and giving, what are you giving of yourself and too much that you feel completely drained with? And then on the flip side, practice saying no and say yes to the things that light you up, which I know is so much easier said than done. I totally understand. But it's just kind of getting you there baby step by baby step. Next slide. Ooh, sense of meaning. So it's kind of like the definition of character, right? Who are you when no one is looking? Are you picking up that piece of trash that's not yours on the side of the road and putting it in the garbage? It's those little things that will help spark and keep that motivation and momentum going. And again, how are you utilizing your gifts? And what gives your life meaning? Is it your friends? Is it your family? Is it your profession? Is it everything? And how are you giving back? And so the gifts, I'm going to go back to the whole gift thing. It's also about volunteering, right? And so like volunteering at a hospital, that's funny, but you could, volunteering at a hospital, volunteering at a, pet shelter, volunteering, at a food bank or a soup kitchen. It's those things that you can give back that also give you meaning into your life, which is really, really important. And then what do you believe within yourself? Again, that value, worth, and importance. And then what went well? I know this is a lot of information. I'm sure you'll get the slide deck. And so don't worry about it. It'll be great. And as you see at the end of these, I did put in my little thing about I run workshops for EMS and healthcare providers. And so I just wanted to highlight what I do for those and the different types of frameworks and conversations that we have that are attained to this. Next slide. And lastly, the sense of love, you guys. What does your love life look like? Is it full? Or do you have some areas to work on? And again, it's all about joy and what sparks you and what lights you up. And so when I see like newborn babies or babies, my eyes start twinkling and my smile gets like incredibly huge. And so it's those types of things that I can start saying, oh, as like activations. I love the feeling that I'm having. How can I get that every day? And so I just start incorporating, I can't see newborn babies, unfortunately, every day. But it's like, all right, Kens, you love that. So I started volunteering at the Children's Hospital so I can hold little babies. The next one is just practicing gratitude every night, right? You can before you go to sleep, name 3 things that went well. And then also mindfulness, which is a whole different thing, but that can be roped into spirituality and into religion, which it doesn't necessarily go hand in hand, but it's just practicing that gratitude and practicing that mindfulness. And this is really hard for some people. Loving your body, love for your body, love for your, everything that you put in, love for everything that comes out, just everything for it, how you look and how you feel and how you're treating it. And so a lot of my clients, we work on self-confidence, and that comes with knowing who you are. And so we have to, kind of go through layer by layer, the sense of love and loving your body. Next slide. I put in little lungs for you guys because I thought that was funny because of like your professions. Taking a step back, how was that? Thank you, Chris, for smiling. I was waiting for that the entire presentation. How was that, you guys? Was that a little oof to oofties? Have you guys done this before? And when I say oof to oofties, I mean it was a little bit harder, a little bit uncomfortable, a little bit like, ooh, I've never done this before and I don't want to do it. Or like, okay, I get it.
I think for me, I don't take time to slow down to even recognize what my brain or body is feeling. And especially folks that are working in a clinic, how do you do this quickly between patients? Like get your scan, recognize those feelings. The gratitude, that really resonates. That's something our family does. But I picked that up from an echo presentation when we had a presenter talking about yes, you should be asking your kids about what they're grateful for and the small things that went well that day. And that really hit home for me. That was something simple that I could take away, and it makes that huge impact. But what's going through my brain listening to you is, oh my gosh, like I probably don't take time to recognize these things about myself, and I need to pay more attention to that.
Thank you so much, Erin, for sharing that. I think like, especially in everyone's line of work here, it's like, all right, Ken, that sounds great. Like I work from home, right? So I can do these things and I'm used to doing these things, but people like my sister who's just like, are you kidding? I work like 80-hour work weeks and have a family. And so my coaching hat and sister hat comes on, of course, and just says, besides wanting to slap her upside the head and saying, use your commute. Use your commute. You don't have to do this every day, but turn off the music, turn off the podcast. I need my GPS wherever I go, so I can't turn that off. But then I start doing that body scan. And I'm sure you guys have read the book, Atomic Habits. And so it's adding on or doing habit stacking onto things that you're already doing. So when you're making your bed in the morning, you can just, what are three things that you're looking forward to today? And while you're making your bed, you can say that. When you're filling up a glass of water, and I hope this doesn't sound whatever, but I feel that water holds memory. And so I speak literally, I say the word love. I can't believe I'm telling you this, but what is, I speak the word love into my water before I fill it up. And honestly, like I just feel so much better. So it's those little things that we can kind of start doing or habit stacking onto things that we're already doing in our everyday life. Anyone else want to share? Awesome. Okay. All right. Are you ready for another one? Sort of, a little bit. Boundary setting. So I thought that was kind of a funny little thing. We're going to be doing boundary setting utilizing your core values and beliefs. And so I know that these words, shootskis, are a little bit smaller. And so I'm going through some exercises. Can you do the next slide, my dear? So these are the questions that go with the boundary set or with the core values and beliefs list. And so I don't know, let's see how we can do this. I can go through the questions if you want, and then Cinca, if you want to keep the slide up the next or the slide beforehand, that would be great. Does that make sense? Yes, sweet. Okay. Thank you. So in order to create boundaries, it's not necessarily because of we're just in fight or flight mode, right? And we're like, no, 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 no. I don't want to do this. It's saying no with intention or yes with intention. And so the questions that are on the slide is picking out 2 or 3, whatever you want, core values and beliefs that resonate with you. So I'll give you like a hot second to do that. And if you can see it, can you guys see it? I don't know, Cinca, if you need to enlarge it. Yeah, it's tiny. Yeah, and they're the same thing. One is just has a different format than the other. If you want to pick one, Cinca, that's fine. And then you can enlarge it. Is that better?
It looks better, yes.
Thank you. I'll give you like 30 more seconds because I don't want to run out of time for you guys to go over. Does everyone have their, or you can just pick one, whatever one you want for this one. Does everyone have their like 2 or 3 or at least one? I'm just going to take that. Awesome. Thank you. I'm just going to take that as a yes. So the question is, what does creating this boundary with the word mean to me? And again, you can write this out or you can just think about it, whatever you want. What does creating this boundary with this word mean to me? And by choosing that, what would having this intentional boundary bring into my life? Again, what would having this intentional boundary bring into my life? The next one is when I stand in my core value and belief, what does the boundary look like? And what does it feel like? Again, what does this boundary look like? And what does it feel like? And then when I let someone or something cross that boundary, what does that feel like? Again, when someone crosses a boundary, what does that feel like? And then the flip side, right, of what can I do to re-engage in this boundary? Again, what can I do to re-engage in this boundary? And last but not least, this is the clinker. It's going to be so good. What do I need to let go of in order to create this boundary? Right? What do I need to let go of in order to create this boundary? And then to wrap it all up, it's what is my new intentional boundary? Again, what is my new intentional boundary then? Erin, do we have like 10 more minutes?
We're good till 1:15, but usually we end a little beforehand just to do discussion.
Okay.
I don't know about anybody else, but this exercise was challenging for me. Like thinking about how do you say no? We're all in the business of taking care of people, and we do everything we can for people to make sure that they feel good and everything is going well. So I think that's what hit home for me looking at this is like, oh my gosh, how do you feel okay saying no? And just being able to like put more into that and thought behind that is helpful for me. And I'm still pondering.
Yeah, this is a lot of, this is a lot of work to do. Just these, couple of exercises. It's not for the faint of heart whatsoever. And so, again, with caretakers, providers, professionals, we're constantly saying yes We're constantly people pleasing and saying yes when we really want to say no. You have to stuff your emotions between your toes. You have to build up your walls. You have to do all of these things in order to keep going. And so my questions during these, different types of exercises are just, what about you? How are you taking care of yourself? What does that look like? How are you re-engaging with your thoughts and emotions? And how does that feel when you do? So yeah, it's hard. Thanks, Erin, for sharing. It is absolutely hard and makes you scratch your head a little bit on what your intentional boundaries are. And you can do this on the flip side as well with your relationships. And so a lot of my workshops I don't mandate it, but I strongly say, please bring your partner or spouse or significant other if you have one. Because growing up in a healthcare household, it's hard to see when your parent or your sister or sibling or what have you is struggling, and you just want to reach out and, give them a hug. But then sometimes, and not daddy, of course, but like if you don't necessarily re-engage and kind of come out of that mindset of, I'm at home now. I can take this, I can take my coat off. I can, let my hair down a little bit. It's hard to re-engage with a person who's not engaged with themselves or with others. And so this is all about coming back to yourself. And as, relationships and everything like that come into your life, and especially with your partners, they have a huge stake in it too. And so it's asking them the same questions, and it's talking about supporting one another. But you need to start supporting yourself first, just like what you do for your patients every single day. So it's turning that light that you give so beautifully on others, and it's turning it inward. And it's shining the light on those places that you don't want to look at because we put it in a box, high above in the closet. But sometimes in order to start healing, you have to take it down and figure out what it is and what's in it. And going through these exercises is just a small snippet, of all the big, beautiful things that are out there. Yes, thank you. Samantha says compartmentalization is what we do when we don't take care of ourselves. Absolutely. Absolutely. It's not re-engaging with yourself after a hard day and seeing the worst of the worst, right? And everything. And so you need an outlet. You need to talk about it, or you need to run it out or work it out or something. My dad exercises for 2 to 2.5 hours every day. And people ask, like, how is he in such a good mood? I mean, Dad, you're on here. And it's like, oh, let me tell you, he works out for 2 to 2.5 hours every single day and does not miss a day. And I think, and he can speak for himself if you wanted to come off, you mute, but that really helped put in a different type of mindset and shift and work out his emotions from everything that he saw. But that's just my guess. Sanka, did you want to go to the next slide? Awesome. And then, so these are just the questions that I was, that we were going through on the other yellow. And so what's next? How can you incorporate these frameworks? I think the biggest thing is just practicing gratitude. But it's not skipping over the hard stuff, right? Like, what is that saying of like, oh, it's like a perpetual positive person where they're always looking on the bright side. And it's like, well, that kind of stinks. It's to incorporate these frameworks. It's identifying your emotions, acknowledging them, and then figuring out what you want to do with it. Is it yours to keep, or is it yours to release? And then, of course, you guys, treating yourself like a patient. Like, would you ever talk to a patient the way you talk to yourself sometimes? Probably not. So why does that patient get to deserve all your love and compassion and support when, you don't necessarily do that for yourself? For the people who are not in healthcare, I always say, speak to like you're speaking to a child or a grandchild. It's like you would never yell at your grandchild the way that you sometimes yell at yourself. Treat them like you would be treating, like a cute little 4-year-old. We didn't go through some grounding practices, but Erin kind of talked about it, and we did too, about, when you're going through that body scan, you can just release all of the emotions or like the heebie-jeebies or whatever, and do like a couple of like little body shakes or jumping jacks and just jump up and down to release it. And then, of course, in your car, you can go through the body scan too and do whatever you want on your commute. And like I said, I do run healthcare workshops. So if you need me, I'm absolutely here. My contact information is in the next slide. And then, of course, you can talk to your EAPs, right? Your employee assistance programs, and figuring out if there's anything there that can definitely help you, stick to who you are, but just, again, shining that light inward. Oh, sweet. Thanks. And that is all I have. And so thank you. Oh my gosh, Craig. Our brain makes 35,000 choices a day. Most are done reactively from our mesolimbic. You guys, again, not in healthcare, mesolimbic midbrain, and unfortunately not proactively from our intentional prefrontal cortex. I don't know what that means, you guys. Does that mean it's mechanic?
Craig, do you want to unmute?
So good, Kenzie. Thanks so much. But I got to go to a new meeting. But that was wonderful. So practical, so helpful, spot on. Thanks.
Thanks,
Yeah, we just react. We don't think about it. So
Okay.
that's why we say, I'll go home and my wife will say, you can volunteer to do that. What were you thinking? And the answer is, I wasn't. I was feeling. But thank you so much.
Yes, you're welcome. Thank you, thank you, thank you. Yeah, Melissa, so you are the EAP person? Like, tell me more about that.
Well, no, I'm the only person. So I guess that by default, that makes me EAP as well.
Meaning you're the only person. Tell me more.
I am the only person in my own company.
Oh, gosh. Oh,
so I am HR, and that lady's mean.
I understand. Yes, I understand that a lot and as well. If you guys need anything, obviously I'm here, but how did that feel, right? Now, I don't want to know what you're thinking, but like, how did that feel? If you wanted to say your thinking, of course. Was it new?
I think my takeaway from the presentation is that providers, or at least the ones that I've gotten to know and have worked with, have it figured out, because Kurt runs in the morning with Chris Hagen, who's also on the call, and your dad works out. I'm like, maybe that's something that I need to be doing more of for self-care. Self-care is what I struggle with because you're busy. I mean, not only do we have our clinical jobs, but then those of us that have families and other obligations too, it's like, how do you fit it all in? But I think the takeaway from this is it doesn't have to be this big grandiose thing, just as long as you think of yourself at least once a day and maybe just taking a few deep breaths or a quiet moment, whatever that looks like. But like I said, I did have a hard time like with the boundaries and saying no exercise. I'm bad about that, so I'm going to be spending a little more time looking at that one after we close up shop.
Oh, I love it. I love it. Thank you.
The morning exercise is definitely the way to go. And until you get injured, I had a little setback here about a month ago, so we've taken a month off, and it's definitely changed my work-life balance. I got to get back into the swing of things here. So,
Marcy says, I think the workout every day is so important for me, and prayer sustains me. Thanks for sharing, Marcy. And like I said, this was so serendipitous because we were on a call with Marcy yesterday, and she's like, life just feels heavy sometimes with the patients that we care for. Like, how do you kind of get yourself out of that rut? And I think we've all been there. So thank you so much for giving us some tools in our toolkit and just provoking more thought for us folks that don't really slow down a whole heck of a lot and, pay attention to those feelings, right?
Yeah. Yep. It's a little scary to begin with, but you guys can do it. You faced much harder things, I promise.
Any other questions for Kenzie? Comments, thoughts? Did anyone else struggle with exercises, or was it just me?
I struggled. I tried. I took everything seriously, and but it's hard, that introspection.
Yeah. Yep.
Yeah, I think it's really hard, especially when it's not your usual habit to do that. If you don't do introspection, it's like anything really. You have to practice to really get it to work.
My initial response when the screen came up was, whoa, that's a lot of feelings to choose from. Kurt, what did you think? You're sitting there smirking.
No, I was, to me, when I thought about Marcy's phone call yesterday and we were talking and I was thinking about that all day, and it was pretty interesting because, if you think about doing family medicine, and 65% of people that walk in your door are going to get better no matter what you do, right? And so you get that as a win right off. And then you probably, if you're doing a good job, the majority of the patients do really well, and you have some failures. And I think, and to some degree, what Marcy talked about yesterday, I mean, when you look at addiction patients, I don't get that 65% of them doing well if I did nothing, right? It's just a whole different patient group where you struggle to get 60% of them to even come back. And so it really is, you don't get the same kind of kudos of people doing well and in the same level. And I think that can make it really hard. And although we have great successes, we also have great failures that make us all second guess what we've done, or didn't do, or should have done, or done differently. I mean, it's tough because, we have a lot of overdose deaths. We have a lot of patients that disappear, and then you see them in the paper, and it's hard sometimes, I think, to understand that we help the people we help, and we can't do everything for them, and sometimes it doesn't go well. And so I do think it's the addiction world, and the kind of work that we're all doing is a different animal, and it makes it, I think, certainly one of the most difficult. I don't think there's another subspecialty where you're just dealing with people whose lives are chaos. There's a lot of trauma. There's a lot of death, and there's a lot of morbidity, and so it wears you down. And I think being able to decompress, like my decompression is driving home every day. It's that 30 minutes of kind of thinking about stuff, trying to put it away before I get home. It's cutting wood, and being out in the woods, or it's running, or it's something. But I think that letting go of some of the things that have gone wrong, not necessarily because you did anything wrong. It's just, that's the nature of this disease, right? And so, yeah, I thought Marcy's comments yesterday were pretty interesting, and something that we, that we think about.
Mm-hmm. Any other folks that want to share? Marcy put in chat, this was timely. Thank you.
All right. Well, we will let Kenzie go. And thank you so much, Kenzie. Very, very fun talk. We really appreciate you spending your time with us today. And I think everybody will take away something from this, and it'll all be different for everyone, right?
It definitely will. Thank you so much, you guys. Thank you for all you do every single day. Take care.
Thank you.